If you are 65 or older and you find yourself suddenly without insurance, but you're offered COBRA, should you take COBRA? Maybe. Every answer is going to be maybe, right? What is COBRA? Let's start with COBRA. COBRA, C-O-B-R-A. The name doesn't mean anything. It's a Consolidated Omnibus something act, like whatever. What it means is if I had employer health insurance and I get fired or I terminate, I have a certain amount of time that they have to let me keep it. And there's different rules if you're the employee or if you're the child or if you're a divorced spouse. There's different amounts of time. And it also can vary by the state you're in. New York's a little bit more lenient, generous. But you can keep that insurance for a while till you land on your feet. So most people think that's a great thing. It's exact same coverage that you had while you were at work. But you have to pay for all of it. COBRA is very expensive. While you were working, your employer paid for some or most of your health insurance. That was a big benefit at your job. But when you go on COBRA, you have to pay for all of it. And so a lot of people get major sticker shock, but they still take COBRA because they feel like it's something, like it's a win because they're allowed to keep it even though they got fired. And so they feel like it's a win and they don't look at their other options. And it's critical that if you're at Medicare age that you understand that COBRA is not your friend. I don't know how to put an exclamation point on that. Boom, COBRA is not your friend. So COBRA not only is expensive, but it is not credible coverage for Medicare. What does that mean? I know there's just certain words I have to use. If you're going to get ready for retirement, you got to learn this credible coverage. That means if I'm 65 and I could either go to Medicare or I could go on COBRA for a year. If I go on COBRA and I later want to sign up for Medicare, I will have a late enrollment penalty because it's not credible coverage. It's not as good or better than Medicare. And it actually might be, but as far as the government's concerned, the way they wrote the rule, COBRA is not credible coverage. Now you're like, that doesn't make any sense because my employer had over 20 employees. It was credible coverage. You told me it was credible coverage. HR gave me a letter saying it was credible coverage. How can the same plan I was on at work that I'm on now, even though I'm just paying for all of it, how can it not be credible coverage? This is your government. This is how they wrote the rule. Don't try to make sense of it. Just remember, it's not credible coverage. So sure, you can be on COBRA for a couple months, but don't be on it to the point where you're getting a late enrollment penalty for Medicare. So let's give an example. I had somebody call in yesterday. I said I was on my husband's work plan. He lost his job. I'm on COBRA. He said, don't worry, I'm going to get another job. Just stay on COBRA for a couple months and then I'll get another job. So I only took COBRA because COBRA was expensive enough. Okay. COBRA was a lot. I didn't get Medicare because I don't want Medicare. He's going to get another job and then I'll go on his work plan. And a lot of people make this assumption. The problem is COBRA is secondary. COBRA supports Medicare. If you are 65 or older, you have to take Medicare. That's your health insurance. COBRA will support it. So a lot of people just take COBRA because like I said, COBRA is expensive. They don't want to pay an extra almost $200 a month for Medicare. They're just fine with COBRA. They don't understand, and nobody's telling them, that if you don't have Medicare, your secondary insurance really not going to be very valuable. You're paying a lot of money for not very much coverage. Medicare would pay 80%. COBRA would pay the 20%. So if you don't have the Medicare and you only have the COBRA, you're paying the 80%. Yeah. Very expensive mistake. So most people are not aware of that. They're just worried about, am I going to get a late penalty for Medicare? What if my husband doesn't get a job? How long do I have to be on COBRA? Let's say I'm 65. How long do I have for him to try to get a job before I need to pull the chute and get on Medicare? Now, I'm telling you, I want you to get on Medicare right away. But this is what people think. They think I can save that money and just be on Medicare. And insurance is a gamble. You can't save that money because you might not get sick in those months, right? It's a gamble. So how long can you be on COBRA before those late penalties start? It's a whole bunch of different dates. Medicare Part D, the drug plan, only gives you 3 months. Medicare Part B, the primary, gives you 8 months. So I tell everybody, you need to make your decision right away. Make your decision in 3 months. That way we're clear. Because if you waited to the 8 months and you forgot about this, now you have a late penalty for your drugs. We want you to make the right decision. And the right decision is if you're 65 or older and you find yourself faced with COBRA or Medicare, your answer is really COBRA and Medicare, or forget COBRA and just go straight to Medicare. COBRA, like we've said 15 times in this video, is very expensive. Medicare is the unknown. You've been on this work plan. So you like your work plan at work. You might have been on it for many years and you're comfortable with it. You're familiar with it. And that's the key. People don't like the unfamiliar. Their husband already lost their job and now I got to go figure out Medicare. No, I'm just going to chill out and write it out on COBRA for a couple months. No, you're not. Because now you've watched this video and you understand that that's not an option. Medicare. You know, it's hard for me to say most of the time because generalization, everybody's different. But I'm going to do it. Medicare, most of the time, is going to be cheaper coverage and better coverage than your COBRA anyway. You don't know that because you're not even looking into it, but it is. Now, there are always exceptions where I would say, even though Medicare's cheaper, even though Medicare's got better coverage, I recommend to you to stay on your COBRA. You're like, what? Because of your medications. Oftentimes, the drug benefit you have in your work insurance, and if you've gotten this, I'm going over my shoulder to your work insurance that you had before your husband lost his job. That oftentimes has a better drug benefit, a better price for your expensive medications. Therefore, the same price on COBRA, which is better than if you go over here to Medicare. Medicare Part D, the drug plan, I don't know if you've heard about it. It's not as good as it could be, okay? It's a problem. So if you have rheumatoid arthritis, if you have cancer, you have all kinds of expensive drugs. Maybe you're just taking an expensive osteoporosis drug, an injection. That one drug might sway this whole decision for you. To stay on that COBRA, to write it out with Medicare as long as you can before you drop COBRA and go to only Medicare. Or your husband might get another job. So in my scenario, the client's husband did get another job. But as often happens, when you get a new job, they have a waiting period before you get the ability to go on their health plan. And their waiting period is typically 60, 90 days, right? So theirs was another 2 months before they could go back on that health plan. So ideally, if we re-rolled this mistake that he's made, if they would have called me as soon as he as soon as he got fired, and if they would have asked me, what do I do? I would have asked them about their drugs. And if they would have said, we're really healthy, we take blood pressure, cholesterol, the major stuff, the minor stuff, and we're okay, I would say, good, ditch COBRA. Let's go to Medicare. And we'll get you, if you're really healthy, let's just get you on a Medicare Advantage plan. Explain it to you what's going on. But yeah, that's probably the easy, the most cost-effective way to fill this gap. Or you could have gone with Medicare and a supplement, okay? So one of those options, and then whenever your husband does get a job and whenever the waiting period is up and now he has the ability to get you on that new health plan at work, you can just ditch Medicare. You can just file the form and say, thank you, I don't want any Medicare Part B. And you can just get out of your Medicare Advantage plan. Then you can stay on your husband's plan until he retires at any time. And in the future, when he retires, then we can basically do this whole process all over again based on what's going on with your health and your drugs and the plans at that time. So remember, COBRA is not your friend. If you have more questions, feel free to go to our website, themedicarefamily.com. I have lots of great information there. Plus, I have over 800 videos here on YouTube on a variety of topics for people that are getting ready to retire. And I hope to see you soon. If you like this video, you might really like this video. Check it out.
And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.